Hello, so my name is Devakai Wolf. This is my test subject, Denisa
Carpati?
Carpati. And today we're going to be working on carpal tunnel correction and also cubital tunnel, which is related, and that's actually what Denisa is suffering from at the moment. As well as afterwards, we're going to be doing some correctional stretching or preventative stretching. Right over here is an example of what happens in carpal tunnel. This is the median nerve. Generally, when you work any part of the body from C5, 6, and 7 along the neck down into the brachial plexus of the arm and at the pressure points here, 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 and here down into the wrist, you will have an effect on the median nerve, which becomes impinged in the carpal tunnel here in the wrist. Right over here is another diagram where this is actually one of the biggest problems here, where the flexor retinaculum is a band of fascia that circles the entire wrist. When you do repetitive motion type of work, where you're typing, drawing, any kind of grasping over and over and over, then you start to inflame the tendons because of all of that repetition. They get worn out. They start to swell. When that happens, this flexor retinaculum, on the other side it's called extensor retinaculum. A retinaculum around the wrist is basically all the same retinaculum. But what happens is when everything underneath it gets swollen, there's less room around that or underneath that band. So the band is somewhat turgid, so it doesn't expand very well. It's somewhat flexible, but it's meant to hold everything in place in your wrist, all those carpal bones. When the swelling happens in the tendons and in the surrounding muscles around the carpal bones, then that retinaculum it's putting more pressure underneath because there's less room for all of the muscles, all of the tendons and the ligaments to actually do what they normally do because they're being aggravated and inflamed. This causes the retinaculum as well as the tendons to put pressure on the carpal bones, and then those carpal bones pinch off that median nerve going through the carpal tunnel. Right now, I'm just working some of the muscles in Denise's forearm, and I'm just going to use a little bit more cream. Once carpal tunnel is corrected with proper care from a therapist, or if any of you actually can see what to do and want to help somebody then you can do some of these things, and then once it's done, once it's fixed, and you'll be able to tell because the usual symptoms won't be occurring, like the tingling up and down the arms, the pain, the inability to sleep from tingling, then the person that is cured can keep it from ever happening again with the stretches we'll show afterwards. Denisa, feel free to give me any feedback if I'm...
It's tender in there, actually. It feels like it needs work there. Yeah, right in there.
Now it's good just to wiggle it around a little bit once your patient has given you the okay that this is the right area. Then you can press in a little bit, don't be crazy, but just grasp onto that a little bit and do a little bit of cross fiber over those tendons. Cross fiber is when your finger slides over, and not terribly easily, a little bit of tension in there so that you can make an effect, but obviously if the patient is, wincing and can't deal with it, then you don't want to do that quite that much. But you can press in certain points up and down until you find a place that's not so tender, and then just kind of slowly press through it. And it's called stripping the muscles in here, or in this case it'd be stripping the tendons. I like to squeeze off a little bit too, because this gets the whole area superficially. Now I want to get a little bit more specific.
Definitely feels like it's loosening up there. It's good.
Good. Very carefully, you can get them, you can go into the elbow a little bit. You want to make sure that the elbow is flexed upwards, so that way you're not putting too much pressure on any area, any tendon, any nerve that you could damage if you're putting too much pressure. So you just go in when it's bent, and then you can take it. You can go deeper that way without causing a lot of pain or unnecessary pressure in the wrong area. These are all the origins of the different tendons. And
Right, and that's tender. Mm-hmm.
okay. Right now I'm massaging it over the medial epicondyle of the elbow. And the whole reason for doing this in the elbow is because there are insertion or acupressure points, as you could possibly say, along the sides of the elbow that affect all of these tendons that go down through the wrist, through the arm and down through the wrist, that squeeze off the carpal tunnel and put pressure on that median nerve. Any medical massage therapist would pretty much be able to do this. A physical therapist can do it, and chiropractors, anyone who's been schooled in it. People who know the body, such as those types of therapists, are going to be particularly good at releasing the carpal tunnel or the cubital tunnel. This is called muscle stripping that I'm doing along the major muscles of the forearm here. And now, pulling in both directions, a little bit of a grip on both sides. It's always good to rotate the joints a little bit as you're pulling it too, because that gives you a little bit more flexibility in the joint and gets the muscles used to like their full range of motion. How you doing?
Mm-hmm, good.
Okay, I'm gonna rest it just for a second. I need more goo. This, by the way, is Tramio, so I don't know if I mentioned that already on our little video here. Can you get in closer?
It's ginger.
You okay?
Mm-hmm.
Denise, if I knew you worked in the same building, we could have just come over here together.
That's true.
The world is very small sometimes.
Mm-hmm.
The idea is just to put just enough tension in your pressure to affect a change without making your client want to smack you.
Not there yet.
There are all different ways to be distracted from good pain as well, so. Now my fingertips, my forefingers are on either side of the median nerve running down Denise's arm toward her wrist. Because you don't want to put direct pressure on the median nerve ever. If you put general pressure over it, then that's fine. But when you're actually sticking your fingers in deeper and you're creating a grip, you don't want to put it directly on the median nerve. Right now pulling up over the flexor retinaculum. And my thumbs are over the extensor retinaculum. And I can massage a little bit through there. How's it?
It's really good actually. It feels like it's opening up the whole wrist area.
Good. I'm going to try to go for the popping pretty soon. Just want to get the wrist comfortable. Now, you can feel around in here. Again, either side of the median nerve, which is going to be pretty much smack dab through the middle of the wrist. And you feel around a little bit so you can feel some spaces in the carpal bones. You feel that? Where my fingers are? And then you can kind of pivot the wrist, pushing up with your forefingers on either side of the median nerve, and pull away from that median nerve, kind of like think of the spaces that you're pushing into. Either side. Pivot the wrist up with the fingers, push down with the thumbs and away. So toward therapist, toward you with your index fingers, and away from you on the top of the wrist. I can tell you've been getting a lot of work though. It's not as stiff as some. Okay? What happened there?
Feels like it hit her nerve maybe on the side. There's a sharp pain.
Okay.
Or maybe close to it, I'm not sure.
If it made you jump, that's pretty much an indication of a sharp pain. So I'm going over it more softly. I'm thinking that was the radial nerve. Was it on this side, thumb side?
I think closer to the pinky actually.
Oh, okay. That was the ulnar nerve then. Most likely. So yeah, just gonna, as gently as possible, go over that side. Is that better? I'm just trying to stretch out that retinaculum with my fingertips underneath. I wish there was a way to put the camera underneath.
I can show the shot from underneath a little bit.
Yeah?
Zoom out.
Right there where your fingers.
Where
That's
this
what
one
made
is?
me- No, the other one?
This one?
Yeah, I think that's where it made me jump.
Okay.
Yeah, I can show. If you want to lift the hand a little higher so it's in the light.
That's probably because of that cubital thing going on. The tunnel's in here, right? That cubital tunnel?
Well, it's more on the medial side, yeah.
Really?
The cubital tunnel?
Yeah.
Here.
Okay. So in here.
wants to go down a little bit more right there. It feels like it's really crunchy.
Yeah, that cubital thing is definitely affecting the median nerve because I'm pulling in both directions. And that median nerve does branch in both directions, whereas the ulnar doesn't. The ulnar is only on the pinky side, and the radial is only on the thumb side. The idea is usually always to try to create space in the body, pull everything away from the spine and away from all the center points. Okay. Thank you, Ella. Yeah, I'm literally stripping the fingers. I can get rid of this chair. I'm putting pressure from below the middle finger at the knuckles on either side of the middle finger, going down all the way into the wrist, but on either side of that median nerve, like I said.
Do you want to maybe just show it? Like, turn her arm so you can see.
I can't turn her
Oh,
arm.
I can come behind you.
Yeah.
Yeah. Do you want me to switch to this side for the rest of it, or stay on that side?
Yeah, that's good right there, because we're only going to be another minute here. So, see, I'm just going to be stripping, I am stripping either side. Of the thumbs, either side of that median nerve. How's that?
Feels good.
Okay. And just down. Okay. And then I'm going to pull up. Either side. Spread the hand out. Give everything in the center some space. Almost makes your hand feel like it's a wing. Okay.
good.
I have vague recollection of this, of having it done to me.
Mm.
So long ago.
Mm-hmm.
Yeah.
Which is crazy because most people, everybody works with their hands doing something, so they get so much tension.
Yeah, I'm just working each finger and each muscle in between, up through the knuckles. And kind of stretching it back, giving the hand permission to flip me off if it wants. There. And I'll see if it needs to pop. No. I think it's all nice and stretched out.
Mm-hmm.
C'est tout.